The term neurobehavioral disorder is used to describe behavioral issues or learning disabilities that have a neurological component at their core. They can best be described as misfiring in the brain, and they include Asperger's, ADHD, autism, OCD, Tourette syndrome, and several others. This out-of-rhythm firing or lack of timing results from incomplete or inefficient connections between neurons. Neurons are the cells that make up the brain and the nervous system. And the number of neurons that you have in your brain at birth are all the neurons you'll ever have throughout your life. This number never increases. However, at birth, the brain is only 25% of its adult size, and by the age of 3, it reaches 90%. If all the neurons in the brain are in place at birth, what explains this massive growth during the first 3 years of life? This immense growth in the brain is the result of neurons linking up and forming networks of connections with each other. These functional connections allow different areas of the brain to communicate with each other, and they occur between the right and the left side, as well as the front and the back of the brain, to create an intricate system of communication. If this process is disrupted at any time throughout pregnancy, during birth, or during the first 3 years of life, it is referred to as a functional disconnect. What happens then is that the oscillatory frequency on one side of the brain does not match the other side. Functional disconnect syndrome describes disintegrated function in the brain in the absence of anatomical damage or gross pathology. Depending on the degree of neural disruption, it can produce symptoms that range from mild to severe. Where the child falls on that spectrum from autism to ADHD or from PPD to Asperger's syndrome is determined by the nature of the disconnect. Children with functional disconnect syndrome do not have an orderly sense of gravity, and therefore they do not sense a relationship with space in a normal manner. They have problems with balance, rhythm, and timing, and many of them have problems with a specific type of neuron called a mirror neuron. Mirror neurons in the brain allow us to mirror the expressions and body language that we see in others. This is how we recognize their feelings. But if a child cannot properly sense how another person feels by mirroring them, emotional messages are not received, social exchanges do not go well, and the child further becomes isolated. This is why some children have difficulty making friends, have outbursts of anger, and can't understand when you get angry with them. If the system of mirror neurons in the brain are not firing properly, the child cannot read facial expressions or body language, even though they can understand the words that are being spoken. No matter what neurobehavioral disorder a child is diagnosed with, they all have similarities. They all involve some level of diminished social skills. They all exhibit some form of repetitive patterns of behavior. Most of them have learning disabilities, and almost all of them lack coordination. If you're tired of giving your child Ritalin or some other psychostimulant, and you're looking for a drug-free approach to freeing your child from the bonds of a neurobehavioral disorder, please call our office and schedule an appointment for a free consultation to see if we can help them. If you would like to learn more about our work with neurobehavioral disorders, make sure to attend one of our in-office workshops where I explain everything in a 1-hour presentation. I'm Dr. Simokovich. Thanks for stopping by.